This video was created with the goal of achieving a high score in your exams.
We've identified the enemy, initiating attack. T cells attack cancer cells and drive them towards cell death.
On the other hand, normal healthy cells are equipped with a mechanism to control attacks from T cells. Hello, I am a normal cell, stop the attack. T cells are regulated and cease their attack. Cancer cells have taken notice of this mechanism. They cloak themselves with this, hello, stop the attack device. T cells no longer attack cancer cells that have this mechanism. We all want to somehow defeat cancer cells. What would you do? Immune checkpoint inhibitors are drugs that target this mechanism. In essence, the purpose of these medications is to block the mechanism that suppresses excessive activity of T cells. Question: what are immune checkpoint proteins? Immune checkpoint proteins are molecules that can either stimulate or inhibit the activation of T cells, which are crucial for immune responses. They help regulate the immune system's strength, preventing hyperactivation that could harm healthy cells. Question: please provide examples of immune checkpoint inhibitors that utilize this mechanism. PD-1, or programmed cell death protein 1, plays a vital role in inhibiting immune responses. Examples of PD-1 inhibitors include semiplimab, nivolumab, and pembrolizumab. PD-L1, or programmed cell death ligand 1, can combine with PD-1. PD-1-PD-L1 axis is responsible for cancer immune escape. Examples of PD-L1 inhibitors include atezolizumab, durvalumab, and avelumab. As you may have noticed, their names end with the suffix -mab, indicating that they are monoclonal antibodies. Anti-PD-1 antibody, or anti-PD-L1 antibody, blocks PD-1 and PD-L1 pathways, allowing the T cell to attack cancer cells. Question: PD-1 or PD-L1? When it comes to T cells, let's start by remembering PD-1. For cancer cells, just lightly remember that they have the ligand of PD-1, so you don't confuse PD-1 with PD-L1. Question: are there any other well-known immune checkpoint inhibitors used in cancer treatment? Other widely recognized anti-cancer medications, known as immune checkpoint inhibitors, are utilized to inhibit cytotoxic T lymphocyte-associated antigen 4. The characters in this context are T cells, cancer cells, and antigen-presenting cells. So far, we talked about how cancer cells mimic the mechanisms of normal cells, but this time, the focus will be on the interaction between APC cells and T cells. APCs initiates T cells proliferation, cytokine production, and killing of infected or cancer cells. At the same time, there are systems that control T cell-mediated immune responses. If we block this system, wouldn't T cells be able to attack cancer cells more effectively? Cytotoxic T lymphocyte-associated antigen 4 is a cell surface receptor, binding to the ligands B7-1 and B7-2. This binding delivers a negative signal to T cells activation by making B7 less available to CD28. Examples of CTLA-4 inhibitors include ipilimumab. The anti-CTLA-4 antibody ipilimumab was the first immune checkpoint inhibitor to be tested and approved for the treatment of cancer patients. Question: what are the side effects of immune checkpoint inhibitors? Blocking immune checkpoints can activation of T cells, resulting in various immune-related adverse effects, similar to autoimmune diseases, including dermatitis, enterocolitis, hepatitis, pneumonitis, and endocrinopathies.
Thank you for watching. If you liked the video, please hit the like button. If you want to see more videos, hit the subscribe button.